Christina, and why don't other people who are in the bargaining committee, why don't you come up so people can see who's fighting for a good contract? So I think there's some other people from the bargaining committee. They could just come up. Okay, well, there's some of them are in the back. I guess they're shy. Anyway, so we're going to turn this over to Queasy Jones and Christina Tejada, who are from the Unified Unit, and have been involved in the organizing, and Louise Bucari, who's one of the nurses at the hospital.
Hi, thank you. Thank you all for coming out today. Appreciate it. So I'm an OR assistant at Union Hospital. I work in the operating room, and there's a lot of talk around the hospital about what's going to happen. I'd just like to say that we are at the committee. I'm as part of one of the members on the committee. We are at the table. We are talking with the management, and there is some movement in the contract, but just like everybody said, we are.
Yeah, he's bending over. You'll have to welcome back. Yeah, better. Yeah.
I just feel like I'm bending over, I'm breaking my neck. I kind of want to look at the people as I talk, sorry. Thank you. So, like everyone else is saying, we are trying really hard to keep the jobs and keep the community and keep our jobs in Lynn. We are at the table talking to people and talking to the management and trying to get them to understand that we cannot give up on this fight, because the people that we go back to every day with the information about what's going on in the hospital, about wages. People have been underpaid for so long in the hospital. They really can't just settle for what the management wants to give us. It's the reason why we've been at the table for over a year. Our members and our bargaining committee people are telling us that they're not satisfied with what the management wants to give us. And everybody knows that Partners has the money to pay us. And we've heard, from the table, from management, from their voice, which is Diana Patrick, which everyone should really know. She is not giving us an inch. She is continuing to make the fight a lot harder for us. And it's really not fair. And you can tell when we go back and talk to our members and talk to them, they're not going to settle for this. And we're just trying to get them to understand that we need a certain amount of money for the people that have suffered for so long at the hospital, been working there forever. There are certain people here, I won't say any names, but when I heard that an employee at the hospital had been working for 37 years, okay, and she's only making 17 something an hour, I mean, that was crazy. I never thought I could hear something like that. So, again, I'm Queasy Jones. I'm an OR assistant. I work in Union Hospital, and we stand here together, united today, to improve the quality of care and provide patients, to improve our families and improve our lives. I have a daughter at home, and I'm just trying to build a great life here for her and Lynn, and have a good quality job that makes a decent wage for our family. We need to remain strong, and we need to continue this fight, and we need to make sure that we win a really good contract for us, and that's what we're trying to do, and that's what I'm trying to do as a bargaining committee at Union Hospital. Thank you.
Good afternoon, everybody. Good afternoon. I'm Christina. I work in ER registration at Union Hospital. I also live in Lynn. I'm a cancer survivor and a mother to 3 children. I spend my paycheck in Lynn, but we're paid very poorly in Lynn at the hospital. That obviously makes it hard for us to spend money in the community. We don't have it to spend. We just want to be paid fairly. Just like many of my coworkers, I qualify for Mass Health. I cannot afford to purchase the health insurance that the hospital offers us. We want to be able to afford the services at our own hospital, where we work every day. But many of us cannot afford to pay co-pays and cannot afford to buy the health insurance. I'm on the front line of patient care, and patients will prefer it if the hospital were paying us well, so we can provide you guys with good service, shop in the community, and invest in the community.
Hi, thank you for coming. My name is Louise Bucheri. I'm an RN. I've been an RN over at Union Hospital for 24 years, and I'm just going to keep this short and sweet because it's hot. I just want everybody in the unified unit to know that I speak for every member in the professional unit to say that we are 110% totally behind you, and we will support you and fight with you every step of the way.